Hello dear students, my name is Rukhsana Musayeva and I'm an assistant of Department Internal Disease Propedeutics. Today's our theme is observation and care of patients with disease of the cardiovascular system, gastrointestinal tract and urinary system. First, anatomy and physiology. Heart's job is to pump blood to supply oxygen and reach the red blood cells to tissues and divide it into left and right sides. Contain of four chambers, two atria receives incoming blood and two ventricles pump outgoing blood. One-way valves keep blood flowing in the proper direction. Aorta, body's main artery, receives blood ejected from left ventricles. And heart's electrical system controls blood pressure and heart rate and coordinates atria and ventricles. The cardiac muscles is a myocardium and the heart membrane is a pericardium. Automatic nervous systems controls intravoluntary activities. The ANC has two parts: sympathetic nervous system, fight or flight system as anxiety or stress, and parasympathetic nervous system, slows various bodily function as rest, defecation, etc. Arterioles and capillaries are smaller. Capillaries connect arterioles to venules. Venules are the smallest branch of the veins, and vena cava return blood to the heart. Superior vena cava from the head and arms, and inferior vena cava from the abdomen, kidneys, and legs. Coronary arteries are blood vessels that supply blood to heart muscles. In this picture, you can see the function of the heart pump blood to all parts of the body. Cardiovascular disease. First is acute rheumatic fever, chronic rheumatic heart disease, hypertension disease, or maybe it's called a high blood pressure. Fourth is ischemic heart disease, or it's chronic heart failures. Fifth, pulmonary heart disease and disease of pulmonary circulation. Others form of heart disease, cerebrovascular disease, and disease of arteries, arterioles, and capillaries, disease of veins, lymphatic vessels, and lymph nodes, and list is other and unspecified disorders of the circulatory system. Hypertension, or commonly called a high blood pressure. Systolic and diastolic measurements of blood pressure is normal systolic in 110 to 130 millimeters, and normal diastolic is 17 to 90 millimeters, and 160 to 95 and 140 to 19 is abnormal blood pressure. Common symptoms of a high blood pressure is a sudden, severe headache, strong pounding pulse ranging in the ears, nausea and vomiting, dizziness and warm skin, dry or moist, and nosebleed. Coronary atherosclerosis, a disease of the coronary arteries, is almost always due to plaque. Atherosclerosis, defined as a buildup of calcium and cholesterol in the arteries, can cause occlusion of arteries. Fatty material accumulates with age. In this picture, you can see the normal section of artery, and the second one is a tear in the artery walls. In third one, you can see fatty material is disposed in the vessels of wall, and on the last, it's totally closed by the fat. And atherosclerosis, this is a causes maybe the family history. If one of the family members have an atherosclerosis, it maybe exists in the patients. Smoking, high blood pressure, diabetes, physical activities. If patients do not do some physical activities, it increases the risk. Obesity and of course alcohol. And signs and symptoms of atherosclerosis is tachycardia, bradycardia, palpitations, weaknesses, nausea, sweating, shortness of breath, chest pain, and sudden death. Angina. Angina defined as it's a clinical syndrome characterized of chest pain occurs when the heart's need of oxygen exceeds blood. Causes angina by atherosclerotic plaque. Cigarette smoking, high blood pressure, high cholesterol, high blood glucose level, it's in diabetes, lack of exercise, and stress. There are the types of angina, stable angina, or maybe it's called the classic angina. Stable angina is characterized by central chest pain, discomfort, and or breathlessness, and is relieved by rest or nitroglycerin. Unstable engine, acute coronary syndrome. Unstable engine is characterized by rapidly worsening engine. It's the most dangerous and does not follow a pattern. Do not relieve it with the rest of some medicine, example of nitroglycerin. The common sign of unstable engine are breathlessness, nose, and vomiting. Causes of heart failure. Coronary artery disease, uncontrolled hypertension. Other factors that contribute to weakness of the heart muscles are toxins, infection, myocarditis, valve disease, and damage from myocardial infection. A classification of heart failure. Left side heart failure. It occurs primarily in the lungs from backup of blood into pulmonary veins and capillaries because of left ventricular pump's failure. As blood backs up into the pulmonary bed, increased hydrostatic pressure causes fluid accumulation in the lungs. Blood flows and consequently decreases to the brain, kidneys, and other tissue. And second, right side heart failure. Its systematic circulation results from right ventricular pump failure. As blood backs up into the pulmonary bed, increased hydrostatic pressure produces peripheral and depending pulmonary edema, venous congestion in the kidneys, liver, and gastrointestinal tract also developed. And we can continue. Arrhythmias is defined as a failure of the conduction of impulse through the AV node. Causes of arrhythmia is drugs, ischemia, chronic heart failure, and failure of SA node. Signs and symptoms is tachycardia, fatigue, palpitation, and sudden death. Management of arrhythmias. Record BP, ear, and rhythm, rate of days of respiration, and breath sound to determine the dysrhythmia's hemodynamics effect. Ask patients about dizziness or fainting. Make electrocardiography for the patient. Administer antiarrhythmic medication. Assess for factors that contribute to the dysrhythmia. Maybe some is the caffeine, stress, and some medication, right? And assist the patient is making lifestyle change as a diet and